So, Assalamu alaikum. Good evening, everybody, and thank you for joining us to Women Transplantation Society lecture series. We already conducted several lecture series for healthcare professionals that discussed issues related to organ donation and transplantation. We explored the experience of some countries, and we are continuing to also exploring now a very unique experience from Iran. And I am sure all of us heard about the experience of Iran and how it moved very quickly in terms of organ donation and transplantation. Today with me is Dr. Katayoun Najafzadeh. Dr. Katayoun is a pulmonologist specialized in lung transplantation in 2000 in Iran, and in 2004 she established organ donation program in one of the main universities of Tehran to increase the rate of organ donation for patients on transplant waiting list, especially on the list of lung transplant, which was her main concern. With her colleagues and their hard work, they could perform some project for increasing the donation rate at the university and could get the family consent rate of up to 96%, making per million people of 32.4. Very interesting, with 10 million population. Dr. Katayoun also, she was assigned as the Director of Organ Donation and Transplantation Office at the Ministry of Health in Iran in 2014. She also established the NGO named Iranian Society of Organ Donation to help Minister of Health transplant management. In 2018, she was assigned for the responsibility of establishing organ donation transplantation registry of Iran and also organ transfer system of Iran. Dr. Katayoun also are hardly working. She's also a member of the ISOD, which is Iranian Society of Organ Donation, I guess, since the 2017. So thank you very much, Dr. Katayoun, for being with us. And before we allow to start, maybe at the same time, I will introduce Dr. Umaid Gobati, then I will give you the floor to distribute the talk between yourselves. So Dr. Umaid also with us today. Dr. Umaid is a medical doctor and has a Master of Organ Donation from Barcelona University, Spain, December 2010, and Gift of Life from Philadelphia, USA. He is an organ donation chief coordinator of Shahid Beheshti University of Medical Science. He is also vice president of Minister of Health Organ Donation and Transplantation from 2012 for 3 years. He's a transplantation TBM faculty in brain death family approach issue from 2013, and also vice president of Iranian Society of Organ Donation since 2016. He's involved in so many projects. Just maybe I will mention some of them. The new model of organ donation in Iran, named new Persian organ procurement model, the first comprehensive specific organ donation education course, and also the first system of OBU quality control of Iran, and also coordinator grading program, and the first program for comprehensive support of OBU, and also the first organ donation and transplantation registry, the first air transport system for suitable organ, and also writing the first World Brain Dead Family Approach book. MashaAllah, both CV, MashaAllah, very full of achievement and credits. And we are glad to have you with us today, Dr. Katayoun and Dr. Umaid, and the floor is yours. So I would like also to remind everybody to write their question in the Q&A section. And also at the end, we will allow for also voice questions. You can raise your hand and then you will be given the mic to speak. So again, welcome to Women Transplantation Society, and thank you for giving us today the opportunity to learn from your experience.
In the name of God, at first, I want to thank the organizers, especially the Dr. Busaid, for inviting us to share our experiences with you about organ donation and transplantation in Iran. Okay, as you introduced me, I'm a pulmonologist, but CEO of Iranian Society of Organ Donation. As you know, Iran is one of the countries in West Asia with about 85 million inhabitants and mostly Muslims and mostly Shiites. As you see here, in 2019, the rate of organ donation in Iran was higher than the other Asian countries, and that's why I think you invited us to give a lecture that how we could get these results, and we are trying to just tell you about the story of Iran about organ donation and transplantation and how we could get these results. The topics that I'm going through are here. I'm going to talk about the necessity of understanding of the benefit of organ donation and transplantation, and about legislation, religious leaders' permission, budget, establishing the system, education, audit and quality assurance, social awareness activities, and supporting donor families with my colleague, Dr. Omid Gabadi. Okay, the first thing which is important is the cost of transplantation for 5 years is 7 times more than 5-year cost of renal of dialysis. I mean, the transplantation is 7 times less expensive than dialysis. So it is very important that governments understand it. It means that money saving. So transplant can save the money for a government, for a country. So it has cost benefit for the Ministry of Health of every country. As you know, 54 years ago, the first kidney transplant was performed by Dr. Sanadezadeh in Shiraz. So although there was enough skills in Iran for renal transplant, but just a few transplants were performed every year. 2 years after the Islamic Revolution of Iran, as you know, because of the Iran-Iraq war, all the resources went for the wars and manpowers, and most of the specialists left the country, and there was no money for the patients in need of transplant. And because of the shortage of hemodialysis facilities, lots of ESRD patients died. To solve this problem, the government decided to send the patients abroad to get the transplant with their relatives. But the problem was there was long queues of the patients for traveling abroad, and the government in the situation of the war could not afford it. To solve this problem, Iranian model of kidney transplant was introduced in 1988. In this model, the government pays some money, 1 million tomans, to the donor, unrelated donor, to just donate a kidney for ESRD patients. This project was excellent, and it could cause lots of transplantation in our country, but because of the inflation and the problem that the government could not increase this amount of money, the donors and recipients started just interacting together, and it wasn't good at all, and it was making a black market. To solve this problem, Ministry of Health just signed an MOU with one of the NGOs named Dialysis and Transplantation Association to control the relationship between donor and recipient. With the Iranian model of kidney transplantation, the number of kidney transplant centers increased in the country from 2 to 30, and the waiting list of kidney transplant was eliminated, and everything was controlled in that time. But still, the number of transplant for the patients were not enough. And another problem was it was about kidney. What about the heart? What about the lung or liver, that they cannot be taken from the living person regularly? So that's why Dr. Irash Fazil talked to Imam Khomeini 2 weeks before his death, and could get the fatwa from Imam Khomeini. And 2 years later, Ayatollah Khamenei gave fatwa and permission for using the deceased donors' organs for transplant. Also, the Sunni religious leaders gave permission for deceased donation in Iran. You can see here the history of organ donation and transplantation briefly. The first kidney transplant in 1968, as I told you, and the Iranian model of kidney transplant and the fatwa. And as you can see here, 11 years after the fatwa, the Parliament Act was established. And interestingly, right after the fatwa of Imam Khomeini, even without Parliament Act, the first liver transplant and first heart transplant was performed in Iran. And then after the Parliament Act, the lung transplant and cabinet regulation and instruction of the Ministry of Health, and pancreas and intestine transplant was performed in Iran. And also you can see here in 2015, Iranian Society of Organ Donation was established. Where the budget comes for organ donation and transplantation. As I told you, in 2000, the Brain Death Act was just approved by the Parliament, and the network for organ donation and transplantation was established. As you can see here, there are some points in Iran transplant law. For example, we need 4 specialists: a neurosurgeon, neurologist, internist, and anesthesiologist to confirm brain death. And after these 4 people, 1 forensic should confirm their work and should confirm that everything is legal. And another point in our law is every possible donor should be reported from the hospitals to organ procurement units. And they are forced to introduce their possible donors to the OPUs. And the Ministry of Health should supervise and manage the audition and also allocation of organ donors and recipients. Another important thing in Iran law is the cost of the organ donation and transplantation is covered by Ministry of Health. So in Iran, poor and rich people can get the benefit of transplant similarly. So it's not like some countries that the recipient pays for the cost of transplant and organ donation. And in this way, the poor people donate and rich people just get transplanted. But in Iran, everybody can get the benefit of transplant similarly. How is the system in Iran? How the centers are controlled? Ministry of Health has a curative affair and has a center for management of organ donation and transplantation. In every university of Iran, we have 56 universities in Iran, and in every medical university, under the coverage of medical university director, there is curative affair of that university, and an office for organ donation and transplantation. And these offices control all the transplant and organ donation activity of that area, of that university. It means that Ministry of Health is controlling all of the organ donation and transplantation centers of Iran through the universities. It can just make everything very regulated and under the control. Okay, I want to show you some statistics. As you can see here, when we compare 2009 with 2019, you can see the PMP of Iran improved from 2.9 to 14.3. How it happened? At first, we learned from Spanish people. We realized that there are some countries very well developed in organ donation from disease. So we tried to learn from them. We didn't want to make the wall again. We wanted to learn how successful people had made a very beautiful wall. And then when we learned, we could just paint it according to our country's situation and conditions. So we try to learn from Spanish people and also from Philadelphia, from Dr. Nathan. Then we established our system according to our country's situation. These are some projects that we run for our organ donation to be improved. I want to explain about some of them in detail. The first thing for a country to be successful in organ donation is to detect the deceased donors. How to detect the deceased donors? Active on-site detection is the most effective method for detecting the deceased donors. But the problem is, as you know, for example, in Spain, they have in-hospital coordinator, but it's very expensive for Iran to have in-hospital coordinator. For example, in our OPU that we had 10 million people under our coverage with 90 hospitals under our coverage, it was very difficult to have 90 in-hospital coordinator and pay them monthly to detect the deceased donors. So we thought about that, what we had to do. We established a project named PPDDP, Persian Possible Donor Detection Program. What was PPDDP? We just hired some inspectors. Who were inspectors? For 90 hospitals that we had under our coverage, we had just 6 inspectors. These were just some middle-aged nurses. We trained them about brain death and everything for just to be familiar with everything about organ donation. And we could take permission for inspecting the hospitals for them from the curative affair of the university. So these inspectors had permission to go to the hospitals every time they wanted. Also, we hired some telephone detectors. They were just medical students or paramedics. We educated them about organ donation and about deceased donors. And they used to call to the hospitals according to a sophisticated program. And also, we just forced hospitals to report their cases to us. And in every hospital, we had at least one of the staff who used to call us every time they had a GCS 3, 4, or 5 patient. In this way, we could increase the rate of detection 7 times more. It means that, believe me, in the ICUs which have neurosurgery, 16% of the death of the patients is brain death. So it means that you have always brain death cases in your hospital beds. Just you have to look for them. And also in the hospitals without neurosurgery ward, 8% of the ICU death is brain death. So it means that even if there isn't any neurosurgery ward in a hospital, you still have too many brain death cases. Once we went to Pakistan for a visit, and I told Dr. Gobadi that I'm really interested to just rent a car and go to different hospitals of this country and find brain death for them, and then introduce the brain death to them and show them that how many brain deaths they are missing. So detection is one of the most important parts of organ donation improvement. Another part of the organ donation process, which has always problem, is taking family consent. Not all of the coordinators have the right to talk to the family if this is our law in our OPU. We didn't let any coordinator with less than 60% consent rate for 2 consecutive months to talk to the family, because if the coordinator doesn't know how to talk to a family, he or she can hurt the family. So they have to be trained, and they have to have regular sessions of training, and the rate of just taking family consent should be higher than 60%. Maybe you have some coordinators with the rate of family consent more than 60% and some with less than 60%. It doesn't matter. You can use the coordinators with a high rate of taking family consent for talking to the family, and use your another coordinators for other tasks of coordinators. So don't let a coordinator with a low rate of taking family consent to talk to the family. At first, they have to be trained. Omid used to just gather all the coordinators. We had 20 coordinators in our OPU, and with these coordinators, they used to discuss about the refused cases. I mean, the cases that family refused to donate organs. They did simulation, and they said, okay, the father said this thing, mother said this thing, and the aunt, the uncle, and they discussed about that. And they said, okay, maybe this family didn't give consent because the father bought a motorcycle for his son, and now he feels guilt. And so that's why they cannot decide to donate. So next time we have to take care of the father and his feeling at first, and then request for organ donation. So this is a science that should be learned, and that's why for in our OPU, Omid and the coordinators could increase the rate of taking family consent to 96%. It means that whenever we had a deceased donor, we were sure that the coordinator could get the consent almost 100%. Omid wrote a book named 85 Techniques, and added 40 techniques to the world family interview techniques. And I'm sure with just reading this book and also passing some international courses that we and also TPM are just holding, everyone could improve taking family consent for the coordinators. What about the taking care of the deceased donors? As you know better than me, the deceased donors are so unstable, and the cardiac arrest is very possible in these cases. This is some statistics from some data from 8 centers of Iran. We evaluated them, and we realized that 56% of the possible donors had cardiac arrest before taking family consent, and 8% after the family consent. And we looked for the causes, and we looked for the methods that we could prevent this early cardiac arrest. This is a letter that we asked Minister of Health to write it and to just send it to different hospitals of the country, and our rules were just like this. Coordinator should be fixed at the case's bedside. So it means that I went to Lebanon once, and I went to a hospital to visit a brain death case, and I couldn't find the coordinator, and I asked for her, and they said she visited the case and left the hospital. It's not like this in Iran. The coordinator should be fixed beside the deceased case, and take care of the case, make sure everything is okay, talk to all of the family members. If they leave the hospital, the family talk together and maybe they decide not to donate. So the coordinator should stay there, and even if the shift is finished, they have to just give the shift to another coordinator and stay with the case until the case has cardiac arrest or it even has organ donation. So they don't have to leave the hospital. And in Minister of Health letter to the hospitals, it's written that hospitals should cooperate with the inspectors and with the coordinators for visiting the patient and also taking care of the patient. When we were in the Ministry of Health, we tried to just distribute our method and our system to all organ procurement units of Iran. And in that time, we had just 16 organ procurement units. But we calculated everything and we realized that the number of organ procurement units should be increased. So according to Iranian law, we asked all of the universities to establish OPU, and we trained all of their personnel with different systems that Omid will explain that. But we realized that, okay, we are doing everything, but still something is missing. Maybe we need an NGO to be beside of the Ministry of Health to do social awareness activities, to do educational courses, and to support the branded families. So we invited the most experts and most famous organ donation and transplantation people of Iran and established our NGO, Iranian Society of Organ Donation. And we are now helping Ministry of Health for everything that is very difficult in the Ministry of Health. And Omid will explain about that. You can see here, this is Dr. Mondegar, the man who, the physician who just performed the first heart transplant of Iran. And this is Dr. Fazl, Irash Fazl, who gave the fatwa from Imam Khomeini. Omid will explain about education and social awareness activities and supporting donor families and audit and quality assurance that our NGO is now doing beside the Ministry of Health. But I want to show you the structure now. We have 31 provinces in Iran, 63 medical universities and colleges. And in almost all of the universities of Iran, we have at least one OPU. In some centers like Kerman, we have 3 OPUs in one state. And also we have 65 transplant centers, kidney transplant 34, and the others, and all kind of transplant is possible in Iran. This is the rate of PMP of Iran. As you can see here, the rate increased gradually to 14.3, and with the COVID, it dropped, but it's going hopefully up again, and I think it could get to the previous numbers very soon, because the rate of organ donation this year was really high. And you can see here the Shiroz Transplant Center and Dr. Malik Hosseini, who established liver transplant. And we are really proud of him and his team. Their center is one of the biggest centers of liver transplant and the first one in the world, according to the number of liver transplant in one center. To take home message, to improve organ donation, it's very, very important to find a successful model to gain knowledge and success parameters. It's not logical to do everything from the beginning. It's more logical to learn from the successful countries and just justify it with the situation in your country. Customize what you have learned with your country's situation and condition, and then design a system tailored to your country, striving to institutionalize the system, and select some full-time, dedicated, passionate managers and educate them. It's very, very important. This is very interesting. Even in Spain, in Italy, and in different countries, in Iran, the rate of organ donation is different in different states. Even with the same legislation, with the same culture, with the same religion, the rate of organ donation is very different, even in Iran. Why it is so different? It's mostly because of the managers. If you can find dedicated, passionate managers and educate them and ask them to do their things right, the success rate will go higher. Hold regular education for related healthcare workers. The Spanish people, especially Dr. Manielich always says, if you have money, it's more useful to use this amount of money for educating the healthcare workers, not to educate the society. Because if you educate the healthcare workers, if the society says something wrong, when they have a branded case in the hospital, all the healthcare workers are doing their job very well. And so with talking to the family, they can convince the family. But if you just convince the society, but the healthcare workers doesn't know anything about organ donation and this is donation, they will talk to the family in a bad way that the family don't donate the organs. So it's very, very important at first to educate the healthcare workers and assign some activities like social awareness, family support, and even teams education to an expert-related NGO to speed up the process and make everything much easier. Thank you for your attention. My colleague, Dr. Omid Qobadi, will continue the explanation about how Iran got to this result. Thank you very much.
Thank you very much, Dr. Katia. Thank you.
Okay. Let me share my PowerPoints. Hello, everybody. I asked my colleague if my internet had some problem in connection. He helped me to show my PowerPoints. Okay. Let me share it. Okay. Can you see my PowerPoints?
Yeah, it's showing now. Maybe yeah, now it is clear. Yes, please go ahead.
Okay, thank you. Okay, in the name of God, the most compassionate, most merciful. Hello, everybody. I'm Dr. Omid Qobadi from Iran. I have been working on organ donation around 20 years. And as you know, and as you see, my presentation is about the role of NGOs, non-governmental organizations, in improving the rate of organ donation. But first of all, I want to take this opportunity to express my gratitude to the course organizers. I really appreciate to be here to share our experience with each other to achieve our common and best goal, that is saving the people's lives. Okay, as my colleague, Dr. Najafizadeh mentioned, we could establish our NGO in 2016 with 11 members of the board and 43 members of the board of trustees in 3 different groups. The first groups are the most of the famous founder and launcher, the first organ donation and transplantation in our country. Like, as you see, Dr. Iraj Fazil, that is a godfather of organ donation in Iran because he could take the first fatwa from Imam Khomeini and start the organ donation, cadaveric organ donation in Iran, and also founder of cadaveric kidney transplantation and also intestine transplantation. Or Dr. Ali Malek Hosseini, the father of liver transplantation, Dr. Mohammad Hossein Mandegar, the father of heart transplantation, Dr. Katayn Najafizadeh, the founder of lung transplantation, and so on. And other our colleagues. The second group is a number of high-ranking cultural officials and supporters from media, government, municipality, production companies, charities, social work, business, and so on. And the last one group is a number of the famous celebrities from cinema, theater, music, virtual arts, poetry, narration, and sports. Okay, after establishing our NGO, Ministry of Health signed an agreement, an MOU with our NGO and outsourced some items like team educations and community educations, research, social awareness activities, donor family support, infrastructure projects, and quality control as a big and executive arm of Ministry of Health. You know that organ procurement organizations are just in charge to case detection, branded diagnosis, case selection, blah, blah, blah. But some of the items are very important. For example, cultural activity, the main issue of organ donation process, because you know one of the most important of shortage of suitable transplant organ in all the world is not understanding the brain death or not accepting the brain death as a death. So cultural activity is a main activities, and family support, education, research, and so on. That's why, as you see, our responsibilities in NGO is OPU establishment, education, social awareness, social work, infrastructures, research, and monitoring. In OPU establishment, we go to one city or one university, stay for 5 days, and one questionnaire should be complete with the university officials, with the university authorities, and then according to this data, we can classify the OPU. For example, the type 1 is an OPU with more than 120 actual donors, and the type D is less than 25 donors. And then we hold some official meetings with university president and curative affairs or the other affairs to brief them the necessity of organ donation and cost benefit of organ donation rather than dialysis. And then we provide necessary structure and equipment for the OPU and supply human resources and specialized team. And also we have a similar international project for other countries named DITMO, means designing, education, training, monitoring for OPU and OPOs, includes 5 phases that I will explain for you. That in the phase 0, we stay 3 weeks in applicant country to collect necessary data like general information, legislation, official position in Ministry of Health, or documents and training, and so on. And then data, we have data analysis phase. After that, we design one strategic plan to start the organ procurement in applicant country, and then implementation, the strategic plan, and also monitoring and support until the full deployment of the plan in that country. And the second part of our NGO activities, the second part is education. In education, the first our activities is training courses. We have 2 types of training course, national training course and international training course. The first national training course is IROS, Iranian OPU supporting system. What is the IROS? You know, in IROS, 8 of the best organ donation teachers stay at the university to establish the OPU for 5 days and train about more than 500 people in each course in 11 groups: medical university authorities, coordinators, related cultural authorities, brain death confirmation, blah, 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 in all the branches of organ donation topics: brain death diagnosis and confirmation, case selection, organ viability. And in our process, we have 1 week training with the best 10 8 to 10 teachers, theory workshop, specific sessions for university authorities, and specific meetings with cultural authorities that you can see. We train all of the in-hospital coordinators and also university officials and also related cultural authorities in all the cities and countries. And the next, our training course is for family approach. In our family approach, we have 3 steps. The first step is regular training course for coordinators to take consent from the branded family, named IRFASC, Iranian Family Approach Specific Course. And also we wrote a book about a branded families interview that Dr. Najafizadeh mentioned, and development of a special protocol for family approach, that is PIEP. You can see that IRFASC is just for family approach to take consent. At the results of our training program in our country, national training, we hold 6 TPM courses in our country. We hold 34 training, organ donation training course, and also 6 a specific family approach training course. We could train more than 7,000 coordinators and 600 organ maintenance, organ management specialists, and more than 1,000 branded confirmation specialists, accompanying around 2,500 cultural officials of the country, OPU leadership training for about around 300 countries' health system officials, and training of 200 interviewers and to approach the family, and training about 3,000 medical and paramedics students of the country, of the city, and training of 2,000 volunteers for organ donation cultural activities. Okay, but we have international training course also. Our first course is ITCOT, international training course for organ donation, that could be inside or virtual, with 40 hours in 4 consecutive days, and participants could be donor coordinators, health professionals, related health professionals, nurses, psychologists, social workers, and so on, and in all of the branches in family approach. And you can see in this course we have general theory classes, group consultation room, game learning, donor plus, role playing, movie learning, memorization station, Q&A panel, daily and final exam. And also we have an international family approach specific course named IFASC. You can see a film about IFASC.
Dr. Ahmed, we cannot hear the voice of the film. We can see the picture clearly, but maybe we can read. I think maybe if it is in Persian, it's okay.
You cannot hear the voice of video?
Yeah, we cannot hear the voice, but we can see the caption and see the, if you can maybe explain to us, or we will read what is written.
Okay. I will send it for you. Okay. And in part of education, we have some compilations like the first organ donation guideline, and also a book for the community, general information about organ donation, and also a book for our branch, ISOD, our NGO branch management manual, 85 techniques book, some pamphlet. Sorry, wait. Okay. we could enter the organ donation content in medical and paramedical curriculum. The third part of our activities in our NGO, as I mentioned, is social awareness. In social awareness, we hold some ceremonies annually to honor the donor families, with the presence of donor families, recipients, waiting list patients, donor and transplant teams, related officials, celebrities, charities, and volunteers, like breath ceremony and okay, and Iran is a breath land, Ramadan ceremony, and holding the annual campaigns, like washing the graves of organ donors at the final week or last week of every year. And also we have a campaign named Each Donor One Seedling. And about our donor card in our website, we have three methods to receive the donor card. The first one, you can get a donor card in less than 1 minute just by sending your ID number to 3432. And also you can enter in our website, ehdacenter.ir, and join to our volunteer projects and also receive the donor card. And this is one of our amazing projects in donor card, that after receiving the card, the donor card, you can record a short video for your family and let your family know what you think about organ donation. Don't leave them alone to make decision in those critical moments. And also in our cultural activities, we held some art festivals like long film festival, short film festival, and the first worldwide organ donation visual art festival was done in by our NGO by sending more than 3,000 artworks in 6 disciplines. And we had a gallery in Iran, in Barcelona, China, India. And in our work, because we need help, all of the related organizations, cultural organization, we have signed more than 200 MOU, an agreement with related cultural organizations. And we have 32 committees, cultural committees, that each committees include 5 to 7 famous celebrities of each art, for example, cinema, theater, music, literature and poetry, visual art, narration. And also we have several infrastructural cultural projects. For example, national organ donation documents from our president. In this project, all of the organizations and institutions have to provide some services to organ donation, and NGO have to provide. The next one is municipal, a document on organ donation from a municipal that according to this project, all the municipal in our country have to provide some services to organ donation. And also we have governmental approval to insert the organ donation symbol on ID card, military service license, driver's license, health insurance card. And we could enter the organ donation cultural and scientific contents in students' textbook to start social awareness from a young age. And also we have the first organ donation news agency, that the new national and international news will put in this agency to use by the rest of agency to distribute the new news about organ donation. We have also one organ donation museum And also, one of the most important document in our country is media document on organ donation. That is an instruction that from our media, our national media president, to all of the radio and television program about the harmful and beneficial aspects about organ donation. Okay, also we have close interaction with national media, and you can see the effect of the media program in our donor card. Now here you can see our website address at the wall of the football field, and you can see here the effect of the sport program on donor card rate, and also the effect of popular TV talk show program that could increase our donor card rate more than 900 to 100 times. Okay, and as you can see, our TV president, our national media president, gave us around 1,500 free TV advertisements annually for organ donation without any payment. Also, in our NGO, we have volunteers program. You know, in our NGO, we are just 14 personnel, 1-4, but we do all of these activities, all of these very complex activities with more than 30,000 volunteers from all cities. Also, we have around 24 branches in all the cities in Iran, and we produce and publish around 100 cultural contents in media. The family support is our fourth responsibility in organ donation in our NGO, that, as you see, we could development the first organ donation social work protocol, and also we trained all the organ donation social workers in Ministry of Health, and meeting with organ donor families, holding recreational camps for families, and holding grief therapy and cognitive behavioral therapy and ACT for the families. And also we have a committee from some of the families to manage the families' needs and problems. And also in social work, we have one of the most important website named IROFAS. In IROFAS, every charity who wants to provide one service to the family can enter the details of his or her service in this website, and this website automatically divide this service to the family, to needy family. Okay, and also we have training of social work interns, and we also have a book containing real stories of organ donor families, waiting list patients, recipients, donor coordinators, to produce artworks by artists. In our research, we have the first organ donation research center in Iran, with compiling articles and plans, and also holding and participating in research congress, and holding the journal clubs, and forming a specialized research team. For example, we have a research team just for education, a team for organ maintenance, blah, blah, blah. In infrastructures, you know, one of the most important responsibilities of our NGO, I mean, Azad Iranian Society of Organ Donation, is designing and establishment and monitoring the infrastructures projects. For example, one of these projects is OTRI. OTRI is the first registry website to register the organ procurement and transplantation data, and also the project OTSI, that is Organ Transfer System of Iran, I mean air transfer by jet. And also IROTDAS, Iranian Organ Donation and Transplantation Data Analyzing System. All of these projects are website. And also IRSOX, Iranian Supporting Coordinator System, and IPCAR, Iranian Program for Coordinator Ranking. About the monitoring, that is the last our responsibility in our NGO for monitoring of performance of the organ procurement units. We have a project named IROX. What is the IROX? Iranian OPU's Quality Control System. The target groups is all of the organ procurement units in two types. The first one, in-person assessment, quarterly. We go to one OPU, stay for just 1 or 2 days, and performance evaluation, finding the roots of problem, providing operational solutions, and monitoring and support for the implementation of solutions. And the second time is the telephone assessment that is 24/7. This is one amazing curve. As you see, after each of training course, I mean IROS, you can see one dramatic increase in our PMP. But 2 months after the training course, it dropped. The PMP dropped. At that time, we held the first insight monitoring, I mean IROX or IROX, and you can see after each monitoring, again, the care raise, drop, and raise. It shows that the training course is not enough to improve the organ donation system in each country. And we need a strict monitoring and quality control. You can see the website of IROX. Just you put the pure data, I mean PMP, brain dead number, potential donor, eligible donor, actual donor, blah, blah, blah. And in outcomes, you can assess detection rate of each OPU, maintenance situation, family consent rate, brain dead confirmation situation, case selection situation, organ viability situation, technical errors of organ retrieval, and cadaver and organ transfer quality. And finally, as Dr. Katayn Najafizadeh mentioned, we could increase our PMP during around 20 years, 70 times more. To summarize, I think some of the most important parameters in organ donation improvement are existing an organ donation non-governmental organization, very important, professional training course, comprehensive social awareness, creating necessary infrastructures, clearing the pathway by research, and not leaving the donor family after organ donation, I mean family support, and a strict and continuous quality control. Thank you for your attention. I'm at your service if there is any question.
Thank you very much, Dr. Katayn and Dr. Umair. Thank you very much for this very clear presentation, and I can understand now how you made a long leap in terms of organ donation transplantation. It's all because of learning from the experience of others and setting the standard, training the people, and also having a very clear roadmap. So now I think I'm sure there is some questions from the attendance, and also with me here, Dr. Alwarat Al-Hashmi, who was having initially a technical issue to join us. Dr. Alwarat is a liver transplant surgeon and also is a board member of the Human Transplantation Society. So now the floor is open for all participants to write the question in Q&A or just raise their hand to ask for the mic. So Dr. Alwarat, you would like to add anything, or you want to ask first until we get the question?
Good evening, Ahmed. Good evening, dear guest, Dr. Najafi, Dr. Gubadi, and thank you so much for your presentations. It seems that your long journey in organ donation and transplantation has what you have gained excellent result, actually. I really did not imagine that our neighbor Iran have this excellent and well-organized program. Basically, maybe we don't hear a lot about you here in Oman, but what it seems actually you have, what you have made since 1974 is really is you have excellent results in terms of education, training, and convincing people regarding the idea of cadaveric donation. Just the question in mind is in terms of percentage till now, let's talk about the last 3-4 years. Comparing cadaveric donation to living donor donation, how much in percentage? Maybe the question is to Dr. Najafi.
Yeah. Nowadays, 66% of the kidneys for transplant is coming from brain death cases.
Okay.
66%.
Oh, that's a really excellent percentage in our Asian countries, with our mentality. What about the reason for refusals? Is it for those who refuse organ donation after death? What are the main reasons for refusal? For example, in our countries, it's a new concept, and mainly is religion, actually. It's not the religion is against this, but still the people, they don't have the idea of donation after death. What about in Iran? Since we are all the same religion. Why they refuse, for example, donation after death, brain death?
Okay. My friend, there are 20 main family refusal reasons in all the world, that the priority of these 20 reasons in each country may be different. But one of the most important reasons is not understanding brain death as a death. Okay, about the religion, there isn't any religion, traditional concept, minority, or everything against the generosity, against the spirituality. And that organ donation is a generosity. My friend, in my country, the Professor Iraj Fazel and Dr. Nobacht and Dr. Katarin Najafizadeh tried around 17 years to convince the religious leaders. It was not it was difficult, but they stay on this accept and tried. For example, Dr. Najafizadeh has had some troubles to Iraq, Ayatollah Sistani, Ayatollah Fayyaz, Ayatollah Hakim, to Qom in Iran, for many religious leaders, to Lebanon, to Syria, to convince the religious leaders. I think that the religious leaders makes their fatwa according to your data, not by themselves, because they are not physicians. They just listen your explanation about the organ donation, And if they can accept organ donation as a generosity activity, they can accept organ donation. I think, because, you know, I am a faculty member of TPM that will go to other countries, for example, China. You know that China has more than 100 tribes. That has many difficult concepts about everything, not only organ donation. But we could convince them that the organ donation is a generosity activity that is not against our religion. So yes, I accept that convincing the religious leader is very difficult. But if we sit in our chair and don't do anything, yes, they cannot accept. You know,
yes, I agree with you, actually. Yeah, Dr. Abid, I agree with you. Actually, here in Oman, we don't have a problem with our religious authorities. They totally agree to the concept. But to deliver this concept to people, you know, is still in process. You know, we started actually recently in the last 2 years, I would say, our activities in organ donation. And we do have some positive results. Hopefully, I mean, soon we'll get some, you know, some of the positive results. I mean, more positive results. We have Dr. Noreen Blushi. She's our colleague. She has a question. So, Noreen, maybe you can introduce yourself.
Saud, please open for Dr. Noreen.
Noreen?
I can't see her name.
لا موجود. She raised her hand.
She raised
Yes,
her hand.
but,
Noreen.
Maybe until we get Dr. Noreen, if you allow me to ask.
I will make you host, Dr. Ahmed.
Okay. Until we get Dr. Noreen, I would like to ask a couple of questions. One of them is for determination of brain death. You ask for 4 people, 4 consultants. We have also discussed this issue and we reviewed, like most of the country, they require 2. So any reason you required 4 people to sign the brain death? Is this a new or old regulation?
Actually, it has been written too many years ago. I mean, about 17 years ago. But we tried to decrease the number of the confirmatory team, but they said no, it's better to be higher to make sure that this case is brain death. And they didn't accept to decrease the number. And we said, okay, because for our OPU, it was actually good for us, because sometimes then, for example, neurologists didn't pay enough attention to the case and didn't examine the case carefully. So we were sure that, okay, the neurosurgeon will compensate for that. And at the end, we could make sure that everything is okay and the case is actually brain death.
And they run the test twice?
No, actually in the law, they have to examine twice. But they say, okay, the coordinator and inspector at the hospital, the first hospital, before transferring the patient to OPU ICU, the patient has an examination by the inspector and coordinator, so it's enough. It means that then the neurosurgeon and neurologist and everyone will visit the patient once, and they take it twice.
Excellent, thank you. I think Dr. Noreen with us now. Dr. Noreen, please go ahead. Open the mic.
Hello, hi everyone. Do you hear me?
Yes, please go ahead.
Yes.
Yes, thank you, Dr. Najafi, and thank you for being all here today. My name is Dr. Noureen Al-Balushi. I'm a liver transplant surgeon, and I'm a board member of Oman Transplant Society. I would like really to thank you for this opportunity to highlight your career and your success and what has been done in Iran, because that would help us, especially that we are kind of sharing the same Islamic culture here, and we are facing a lot of challenges to start this program. I would just like to know that you are focusing on a lot of learning workshops, and I really want to ask you whether these teaching workshops they are in English or not, so we can establish some kind of communication, and we can send our coordinators to you guys so they can be trained, since you have an established system already. And the other thing, I just want to ask you whether you are implementing any centralized donor center, and you transfer the donors to a certain center where you do the transplant, or you do the harvesting in different centers there. Thank you.
Yeah. Actually, we have established the international courses for English people, everyone who can speak English. And these courses are ready. And if you are interested, we can just organize everything to have your coordinators in these courses. What was the second question?
I was asking about centralization of donor harvesting and recovery. Yes.
Yeah. So we have 56 organ procurement centers separate from the transplant centers. Sometimes in some centers, the organ donation center and transplant center is at the same hospital, but it's usually not like this. And we transfer the deceased donor from the hospitals, because there are more than 1,000 hospitals in the country. And when we detect a deceased donor in one of the hospitals, after taking the family consent, we transfer the case by ambulance to OPU ICU, and take care of the deceased donor in the OPU ICU. And the surgeons from different hospitals that the Ministry of Health just according to the list decided which patient should take these organs. The surgeons from liver transplant team, from heart transplant team, from lung transplant team come to the OPU operating room, and everyone take his or her organs and go to their hospitals and do the transplant. And also we have established the air transport of the organs. So whenever we have a donor in, for example, south of Iran, that they don't have heart transplant, for example, there, or northwest of Iran, that they don't have heart transplant, the surgeon, heart transplant surgeon, goes there by jet and take the organ and comes back and do the transplant in their center.
Excellent, excellent. Thank you, Dr. Najafi. Thank you.
Thank you, Dr. Najafi. My other question, allow me, regarding the timing of death. I mean, we have brain death, and then we have like on heart stop. So like the legal system in Iran, does it identify brain death as the legal death and the final death, or the death certificate give the time of clamping, for example, cross clamping, or like other country when they move the patient from ICU? So what is the system of timing of death here in Iran?
Me?
You know, in Iran, the brain death confirmation, you know, in Iran, the first we have a branded confirmation in our process. We have branded diagnosis, sorry, and branded confirmation. Branded diagnosis will done by coordinators, as Dr. Najafizadeh mentioned, but branded confirmation will done by branded confirmation team. Okay, after
Amit, we don't have your voice.
Yes, it get disconnected.
Yeah.
Dr. Omid,
So let me explain, if
please.
Amit. So there are different opinions, but the certificate of death is usually written after the organ donation. I mean, not at the time of brain death, after the organ donation. And if you agree, I want to just summarize what we talked, if there isn't any more question.
Yeah, if you allow me, I will have another question, but if you would like to summarize, okay. But I want to ask the same question, the same scenario, like who writes the death certificate? Is it the ICU doctor? Is it the coordinator, or is it the surgeon?
Yeah, Omid, can you just he's asking that who write the death certificate? Is that the forensic, or is that the coordinator or ICU doctor?
You know, like the other countries, we have two types of branded confirmation: clinical branded confirmation, but for medical doctors, neurosurgeon, neurologist, anesthesiologist, and internist, and legal confirmation by one forensic. So we have to 5 sign in the form of branded confirmation. After 5 signature, after 5 confirmation, we can start to approach the family and transfer the cadaver and retrieve all the organs.
Excellent.
Yeah.
Thank you. We
And
have
usually we ask the forensic to just write the certificate, and if the forensic is not available at that time, ICU doctor sign the death certificate.
Excellent. We have question from Dr. Adil. Dr. Adil, please go ahead, open the mic. Dr. Adil is the ICU consultant.
Yeah, hello.
Hello, Dr.
Can you hear
Adil.
me?
Yes,
Hello.
yes.
Yeah, okay. Thanks a lot for a great presentation. I really appreciate the system of you already started as you mentioned for a long time ago, and your progress is very really and appreciated, and I think it took a long time to approach to that level. My question, we are discussing the same issue, maybe Dr. Ahmed aware that the hospital coordinators, you mentioned clearly about the coordinators, and you are giving courses for the coordinators, and it depends also, you mentioned about the population. Our population is small, and we have tertiary hospital, limited numbers. So I was thinking that these coordinators can be staff nurse, can be paramedics as well, if they are trained very well. In each tertiary hospital, this is one of my comments. I need your comments on that. Second comment is that how does it work, this coordinator? Is it 24 hours in the hospital, or if there is any shift for them? How do you do it? I mean, because we want to apply it. I want to hear from your experience. How do you apply that coordinator? How is doing that 24 hours? Okay, and then we'll move to the next question. I have another question.
Yeah.
Yeah, please, can you?
Actually, we have different kind of coordinators. Most of them are general physician, but some of them are nurses, some of them are medical students. We have one coordinator obstetrics, and also, I mean, in different paramedics or medical courses, subjects. And the important thing, most important thing is training, how to train them. I think if you just put all your forces on training your coordinators, for example, interestingly, the Spanish team says different people from different cultures, different religions, and also different countries, the rate of consent of these people in their own country is really low. But if these people come to Spain, we can get the family consent as Spanish people. It means that if the consent rate in a country is low, it's not because of the culture, it's not because of the religion, it's just because of the coordinator skills. So if you have skilled coordinators, they can get consent from everyone, I mean, with every religion, every culture, every ethnicity, and everything. So try to just educate your coordinators well. And, you know, Omid was my chief coordinator in our OPU, and just was working with the coordinators all the time, giving motivation, giving education regularly, and also checking them all the time. About the time of the work, inspectors were just the supervisor of the hospitals, matrons of different hospitals. After 6 o'clock in the evening, they started inspecting the hospitals. I mean, after their work in the morning, they used to go to the hospitals for money, because Omid designed a project very, very well designed. For example, if you go to this hospital, you take this amount of money. If in that hospital you can find GCS 3, 4, or 5, this amount of money is added to your previous money. And if the case is brain death, this amount of money is added to these two. And if this case is donated, this amount of money is added. So the inspectors used to go to different hospitals and try hard to find brain death cases and donate them. So it was a very successful model. And after the inspectors found the disease cases, or GCS 4 or 5, because if you just follow just GCS 3 cases, you will miss some of the cases, because 50%, according to our study, 50% of the cases come from the GCS 4 and 5 cases. So you have to follow GCS 4 and 5, but by telephone coordinator. I mean, telephone detector stays in the OPU in the morning, call to different hospitals according to a schedule, and inspectors go to the hospital at night and check the hospitals. So if there is any GCS 4 and 5, the telephone detector call to the hospital every day and ask, okay, how is your patient? Is the GCS 4 or 5, or is GCS 3? And then if there is a GCS 3 case in every hospital, the chief coordinator sent a coordinator to that hospital. Coordinators have some shift. And so whenever you are, for example, you have a medical student as coordinator, you know that this coordinator can be your coordinator in the afternoon and night and holidays. And so according to the free time of the coordinators, you can, because none of the coordinators except the chief coordinator and your best coordinator are not needed to be full-time. They are just part-time. Just the chief coordinator should be full-time,
Okay.
and maybe one of the best coordinators.
Yeah. The next comment or the next question. I mean, can you hear me? Dr.
Yes.
Ahmed, you hear me?
Yes.
Yeah. Okay. The next comment, as Dr. Ahmed you mentioned before to you, as branded to be confirmed, according to your regulation, that 4 specialists you have seen. I have seen in your slide 4 specialists. These 4 specialists, I think, a neurosurgeon, intensivist, and anesthesiologist. And the fourth one, I can't remember the fourth one. So these are specialist level. We have consultant level. I mean, can we reduce the number of your brand team to confirm brand test that specialist? You have taken 4 to be, to confirm branded. We are having 2 consultants. Does this equal? I mean, because your label is specialist and we have consultant. I mean, does it make a sense?
In most of the countries, 1 or 2 specialists confirm brain death, and it's okay. But the problem is, for example, when you have a neurosurgeon or neurologist as a confirmatory team, they might be in their hospital doing the neurosurgery, and they are not available sometimes, or sometimes they are on vacation and they are not available. So for every organ procurement unit, we have, for example, 4 neurosurgeons, 4 neurologists, 4 internists, 4 anesthesiologists. And every time we ask one of them to come.
Okay. Yes. Yeah. I got you. And it has to be specialist level, not consultant level.
My friend,
they're all the specialists.
Yeah, I think, because recently I did some of the interviews for Iranian doctors. I think the system in Iran, they don't have a consultant post.
Okay.
Like when we say a specialist, it's like somebody who's already specialized in neurology, for example. So neurology specialist is already, has got that experience in neurology. This is what I gained from some of the information when I did interviews for some of the Iranian doctors here in Oman. Yeah.
Okay. What about
Dr. Adil? Because we are running out of time, we don't want to delay. I think it is now 10:30, isn't it, in Iran? Half 1 hour different. You are in advance, so we don't want to keep you awake.
I don't know. If there is small
Dr. Adil, you have 2%.
Yeah, it's about pediatric.
Sure.
What about pediatric? Have you? Pediatric cases now. How do you confirm pediatrician? Is it one of the team member, or you confirm brain dead in pediatric cases?
No, but the neurologist and neurosurgeon and everyone confirm both adult and pediatrics. And but the criteria is different. For example, the time between 2 visits are different, or so the criteria is different, but the confirmatory team is the same.
Okay, good. All right, then. Thanks.
Thank you very much, Sir Adil. And I don't know if you allow me for final question. There is an organ sharing program like the Euro transplant, where if you don't have a match, then you send that organ. Are you part of the organ sharing between any neighboring country where you receive or send?
No.
Good, excellent. Dr.
Let me give you some data about the number of organ donors. We have 3,000 suitable deceased donors in our country every year. And we can tell you about Oman, because with a PMP of 25, for example, you have 4.5 million people almost. If you have 4 million people even, for every million people, you should have 25 deceased donors. donated per year. If the PMP is 25, it means that every year about 100 deceased donors you have for donations, suitable deceased donors. So everything that you have less than this, it means that you are losing them. You are just missing them. So my final just words is that every country that has organ donation, even just scale and transplantation, especially liver with kidney, it means that there is enough skills in that country. So if the rate is low, you have to try very hard, and we have to try very hard, because although the PMP of Iran is not bad in Asia, but related to world, the rate of deceased donation is in Iran, the rank of deceased donation of Iran is 30. So we have a long way to go still. But I mean that we all have to work hard. Why? Because we proved that in Iran, 7 to 10 people just die every day because of shortage of donor. In US, every day 22 people die because of shortage of donor, but they don't have deceased donor enough, but we have it. We have 3,000 deceased donors, suitable deceased donors. We are using just 1,000 of them. So it means that we have still 2,000 deceased donors that we are not using them. So the PMP of Iran could go really high with more and more effort, and also you in Oman can just go to the top and just go to the PMP of 25 just by working hard, and especially, as I told you, by training the coordinators. And we are ready to share our experiences and our training courses with you, and any kind of help that we can just provide for you to improve organ donation, because it doesn't matter which country and which people. Patient is patient. If we can save just one life, it means that we are just saving all people's life.
Excellent. Thank you very much. And I'm sure, inshallah, we'll work very hard, and definitely we will need your collaboration, especially in terms of training, because it is a good opportunity. They have some courses in English. So at the end, Dr. Luar, do you have anything, or we can close?
Thank you so much, Dr. Najafi and Dr. Obaidi. I think, this Zoom meeting give us actually a clue for further training and further collaboration between us, especially in terms of training for our staff. Thank you so much, and I think this is going to be the beginning of the collaboration between us. Thank you.
So again, thank you very much again, Dr. Kater and Dr. Omaid, and thank for our participant. And this video will be recorded and will be valuable in our YouTube. So thank you again for giving us this opportunity and the time for us. And I'm sure, inshallah, one day we'll see you here and let you, and we'll show you our 25 PMP, inshallah.
Thank you very much.
Thank you
very much.
Have a good night.
Good night. Good night. Bye-bye. Assalam.
Bye-bye.
Bye-bye. Bye-bye.